Bariatric surgery is a really exciting field to be in right now, and it's because over the last 25 years it's changed so much. 25 years ago we were doing something called a jejunal-ilio bypass. We were doing long limb gastric bypasses, and we did them very differently. Today there are four main procedures we are doing to help patients lose weight and gain their life back. The first is gastric bypass. Gastric bypass is a restrictive and a malabsorptive procedure. It's restrictive in that we go inside the abdomen laparoscopically with small incisions. We staple the stomach, creating a much smaller stomach that only holds about 4 ounces of food. We then reroute the small bowel, or do what's called replumbing inside your abdomen, bringing up a loop of small bowel up to that gastric pouch so that food goes one way, separate from the digestive juices, and we make a second connection lower down, connecting two loops of bowel so that food goes one way, digestive juices go a separate way, and it's not until the two mix further down the pipe and start mixing so that you actually absorb some of the food you're eating. So you eat less, you absorb less, you'll lose 70 to 80% of your excess body weight within the first year after surgery. The sleeve gastrectomy is another operation we provide to our patients to help them lose weight. The sleeve gastrectomy is a restrictive operation. It's an operation where we go inside the abdomen while you're asleep, laparoscopically with small incisions, small instruments, and we go in and find the stomach and we staple the stomach, creating a narrow tube that's very similar to the hose in your yard. That new tube holds about 4 to 6 ounces of food and restricts how much you can eat. As a result, patients will eat less, about 1,000 calories a day. They'll lose weight approximately 2 to 5 pounds a week, sometimes more. And within the first year after surgery, they'll lose about 70% of their excess body weight, which is tremendous in helping these patients get rid of their diabetes, get off of insulin, get rid of their hypertension, get off of their hypertensive meds, even if they're on multiple meds, resolve their sleep apnea, get rid of their CPAP machine, and gain their life back. The laparoscopic adjustable gastric band is a restrictive operation we provide to our patients to help them lose weight. The band is a foreign body that is placed inside of the abdomen laparoscopically and goes around the stomach near the upper part of the stomach to create a 4-ounce pouch. Initially, when the band is in, it doesn't have any fluid in it, and it allows free passage of whatever you eat to go through the whole stomach. The band, however, has a balloon on the inside of it, and it has a port which sits on the undersurface of the skin on the abdominal wall that allows us to place a small skinny needle into it and put fluid into the band to allow the band to go from a $half size opening to the size of a pencil. Once that band has been adjusted to the size of a pencil, when a patient eats 4 ounces of food, they feel fullness. It takes time for that food to go through the band, which keeps that sense of fullness for about 4 to 5 hours after they've eaten that 4-ounce meal. As a result, that hunger that patients feel is gone. They feel full for about 4 to 5 hours. They eat 3 4-ounce meals a day, which is approximately 1,000 to 1,200 calories, and they lose about 2 pounds a week. The weight loss with the laparoscopic adjustable gastric band is not as aggressive or quick as with the gastric bypass or the sleeve gastrectomy. After you've had the adjustable gastric band, we expect you to lose about 50 pounds your first year after surgery. During the second year, we expect you to get up to about 55% of your excess body weight, or about 55 pounds if you're 100 pounds over your ideal body weight. And by the third year, hopefully close to about 58 or 60% of your excess body weight.